Why does my upper back, neck, and head hurt? Assessment 1, assessment Dowger's hump. Check mobility of facet joints, check on tightness of supraspinatus muscle, check tissue quality around hump. We're checking out the supraspinatus muscle to make sure that it's not going to restrict us when we start doing these techniques to unlock the joints here. So I just want to kind of soften it up. Okay. You're checking the quality of the tissue in here, see what's binding up. Okay, it's locked up right here. So these are open and they won't close. So I'm going to have my model here, Sheila, to raise her head slowly. You're going to continuously raise your head back and forth as I'm moving the tissue back. You know, these are all locked. They're open and they won't close. All these in here. So we're going to just have her move her head so I can move the facet joints. You know, this is a great technique to help out to get these joints to settle down and relax and give some space in them. So I'm going to just kind of sink in and have her raise her head. Sink in. When her head goes down, my arm moves. And if you find one that pops back at you, that's a closed facet joint. I'm just putting sustained pressures on the closed facet joints. When you find one that's bouncing back at your forearm, just kind of hold space, don't move. So we're taking her head to the barrier, and you find a hard pan there, and then you come back. You don't want to cock the head back. You want to keep it neutral. So here and there, here and there. And I'm going to sink in as she's moving. This is just the same technique we did prone, but a little nicer, a little better. You can, if you get an area in here on the levator scapular where it won't move, you can take and shrug your shoulders. Okay, let go. So go into this groove here. We're not on the spine, we're just off the spine. We're in between the levator scapular hookup and the spine. And we're kind of going right in this area here, the traps and all that. Kind of going like that. Okay, go one more time. You want to, my hand is underneath of her head. She's not doing any work. And you want to get on the laminar groove here. And you want to go like this. So laminar groove, going through the pad.